Hello, Algonquin, and welcome to another informative episode of Learn This. I'm Olivia Cannon.
And I'm Keenan Kreller. Today we'll be showcasing the extraordinary massage therapy program. This 3-year advanced diploma program provides students with the knowledge, skills, and attitudes to offer safe, effective, and ethical care for their patients.
That's right, Keenan. This intensive program isn't made for just anyone. The program is designed for those with the discipline to learn the art and science behind massage therapy in only 3 years.
And after graduation, they're walking away with specialized knowledge in their field, being able to conduct a client's assessment, formulate clinical impressions, and develop full treatment plans. This gives them the skills they need to perform safe and comprehensive massage therapy. This program also places a major emphasis on effective interpersonal and communication skills. It highlights critical thinking and sharpens decision making. Students learn how to meet legal and ethical obligations to match industry standards.
Now, if that doesn't sound impressive to an employer, I don't know what does, Keenan. The program also puts focus on anatomy, physiology, and massage theory. It helps students develop entrepreneurial skills, giving them every tool they need to succeed as a massage therapist.
Today we'll be exploring every angle of this amazing program, starting with an interview with current students.
We got more answers by visiting students in their facilities, and later you'll see a full massage demonstration.
So sit back and relax for a more in-depth look.
2003, and what I absolutely love is watching students come into our program in their first year without any clue about what the human body can do or how we can help, and then over the course of the time that they're here, they transform themselves into really quite wonderful therapists. They can communicate, they can help people with their pain, and I get to watch it. That's the best part of the program. It's always helpful if they have a little bit of background in human sciences. If they're coming from high school, there's a human science biology course, I believe, that they can take, or exercise science. That's a great way to prepare. But the second thing is to not be afraid to come in if they come from another discipline, because massage therapists are actually at their best when they've got good communication skills. Whether or not somebody actually becomes a massage therapist, the skills that they learn in this program are going to set them up for a whole bunch of different directions, either in career or just personally. They learn how to communicate, they learn how to listen, they can multitask, they can consider evidence and do basic skills in research. They know how to educate people one-on-one because they have to do a lot of education of clients. They understand how the body works, so that sets them up for all kinds of different disciplines in healthcare. Well, we're really excited about our new facilities because our labs are comfortable, the lights can dim, so when we're having student clinic, we can get the lights down low. Our skills are our hands, so our technology is pretty low tech. Consequently, we don't have a lot of bells and whistles. We've got a freezer, we've got a wax bath. The most exciting thing we've got is a storage room. So all of these things make for our new facilities to be really wonderful to work in.
Joining us in studio, we have the lovely Marie. Now, we understand Marie's a second-year student in the massage therapy program. What kind of advice would you give for a new student coming in to the program?
Well, first of all, I'd tell them to scrap everything they know about massage. This program takes it above and beyond our basic idea of being a masseuse or a massage therapist. We work so hard, and it's more of treatment, like scars, joint problems, anything like that. Instead of just massage, it's a very therapeutic side to massage therapy, or to massaging, I guess.
So it has more of like a medical platform.
Yes, it does.
And do you treat your clients more as patients, or how do you approach it?
Well, we treat them as clients. We can't really say patients because we're not doctors or anything like that. But we treat them as clients, but we can affiliate with doctors, so a lot of times they get prescribed massage therapy. So they come in with, for medical needs, rather than just coming in to get a massage.
And with that in mind, how would you rate the program? Would you recommend it?
I would most definitely recommend it. If you want a hands-on program and you want to work with the human body and everything like that, it is a perfect program for you.
And would you say this is a passion of yours? Is it something Algonquin helps you develop a passion for?
Oh, for sure. They do such a great job of making sure that you have 100% understanding as to what you're doing, and things like they want you to succeed. So they work with you so hard to get a passion towards massage and for you to actually enjoy what you're doing, so you're not stuck being frustrated that you don't know what's going on.
So they really care and place lots of focus on your success.
Yes, they do.
And tell us a bit about your professors. Are they up to industry standards?
I would say that. I'd say most of them are above and beyond industry standards. They're wonderful people to work with. They all have their own ways of doing things, and it's amazing. It's eye-opening as to the many different ways you can manipulate the body and how their own perspectives play into our own styles.
And is that inspiring to you?
Absolutely.
And would you say, where do you see yourself after graduation?
I see myself working in a hospital along with physiotherapists, occupational therapists with post-surgical patients or rehab or anything like that, possibly cancer patients.
Wow, I didn't realize how medically based the program is, and it actually allows you to work in a hospital once graduating.
Yeah.
So lots of different platforms and avenues you can go down.
Of course.
And does Algonquin help you achieve your career goals?
I would say so. They do a lot of outreach programs, so we get a lot of experience in different things we want. Some of them are sports massage. There are ones that are outpatient in hospitals. There you can work with Down syndrome. They have an HIV clinic we can go work at, so people that need more of a moral support rather than actual physical care.
So many different things you can actually go down.
Oh yeah.
Thank you so much for shedding some light on the program today. We now go to the A building to check out some more of the students at work.
I chose Algonquin because their massage therapy program is it's very like spread out. A lot of colleges have just a 2-year program, whereas we have the 2-year intensive or the 3-year. So it really lengthens the program out, so you can get a better knowledge of everything that's going on.
I'm in this program to be able to help people like my mom was helped through massage therapy.
I chose Algonquin mainly because the massage therapy program here is the best in Ontario, and I wanted to get really far away from my hometown, which is in Collingwood. So
be prepared to understand physiology and just anatomy in general, because that's a very big portion of this program.
If you are good in sciences, it's a good program for you. If you struggle with academically and you're looking for something more hands-on, it is very hands-on, but it's centered around like physiology and things like that.
It's not a bird course, and it's probably a lot harder than you think it is.
Probably clinic.
Well, my favorite part so far is working in clinic with people. That's like really hands-on.
My favorite part right now in second year is clinic.
My favorite part of the program is probably clinic.
Massaging.
Our professors are pretty awesome.
Like they're all really helpful, like and know your name one-on-one, so I always feel good about that.
Very knowledgeable and cocky.
I mean, they're all quirky in their own way, but they're all great. They all have massive amounts of knowledge about what they're doing, so it's good.
Hello, we're back in studio, with Alex, second-year student. We have our table, our cream, and why don't you show us how we would get started?
Okay, so basically, first of all, before anything, we're really focused on patient safety, so I want to make sure that my client here feels safe and secure. And she does. Yep. So basically what I'm going to be showing you is just like a quick treatment to the head, neck, and shoulders. It's something that we treat a lot in the student clinic, and it's mostly due to just student stress. A lot of people tend to carry their stress in the shoulder area.
Is there a reason for that?
It's mostly due to just posture. Like a lot of people tend to kind of shrug their shoulders up when they're stressed out, which shortens up a lot of the muscles in the area. So what I'm doing right now is just kind of like an introductory technique. It's to help relax my client. We call superficial effleurage. And while I'm doing this, I usually get my clients to focus on their diaphragmatic breathing. So I'm going to get you to just take a couple of deep breaths, Shay. Perfect. And how's the pressure?
Good.
So we want to always make sure to be checking in with our clients on pressure and
A lot of communication.
a lot of communication. Open communication is absolutely key.
Is it a specific cream that you guys use?
It's a non-scented cream, just for any allergy conditions that a client might have.
Understood.
And so what I'm doing right now is just sort of more of a muscular technique, just to help bring down some of the tone in the area. And how's that? Is the pressure still all right?
Good.
Good.
So do you need a lot of strength?
Depending on what you're doing, absolutely. To access some of the deeper structures, deeper muscles, you definitely need to be able to apply a lot of pressure.
That being said, do you feel that a male masseuse can apply more pressure, or does it not matter?
I wouldn't say particularly male masseuses can apply more pressure than female masseuses. It really depends on the person.
How big of impact is the non-physical part, such as music or scented ointment?
I would say it just gives the client something to focus on, helps them relax a little bit. I'm just going to turn you over, Shay.
Because you want them to be as at ease as possible?
Yeah, exactly. Perfect. And just arms out for me. Perfect.
Is it usually custom to start on the back and then?
Usually clients like to have their back worked on a little bit more before their front, but there's really no set rules on what structure to work on first. So I'm just doing like a little bit of
another technique
called stripping, just along the neck muscles here, which are usually pretty high toned as well.
Seems like a very portable option. Like you could go to someone's house with your table and do this?
Yeah, particularly with the table we have here. It's a very portable table. It folds up into itself, and you can take it to pretty much anywhere that can handle a table like that. I'm just going to do a little bit of a stretch here. This is just also to help lengthen the muscle and take down some of the tone as well.
Would you often do that towards the end of the massage?
This is usually something you do towards the end of the massage or whatever technique you're working on.
Is there any dangers to it?
We usually cover anything during the interview process, any areas that they can't have worked on, any past conditions. So we always make sure to...
So before massage, it's important to get that interview process
down?
Oh,
absolutely. It's very important to get any information that could help us treat our client better and also safely.
Right, right. In class, do you practice on each other, like former?
Yeah, we have 2 classes every week where we get to practice our testing and our techniques on each other. Pressure still okay, Shay? Yep. Perfect.
Is there any other muscle targeting that would go on when she's on her back?
On her back, you could target, I mean, we generally treat the back as a whole. So you're targeting whatever muscles are impaired, really. It depends on your client's conditions, what they're in for, which, again, we find out during our interview process.
And we have 30 seconds left. Is there any advice you would like to give for students who are debating joining the program?
I would say just make sure you know what you're getting into. It is a lot harder than a lot of people assume. And it's a really fun program. Teaches you a lot of useful skills.
Was it harder than you expected?
Definitely harder than I expected, yeah. But
in a good way?
Oh, in a great way.
Challenging?
Challenging, and love every minute of it.
That's great. Thank you so much for stopping by.
Oh, thanks for having us.
Thanks to both of you. You really expanded on our knowledge of the program. To think you can achieve all of this in only 3 years is pretty amazing. Next time on Learn This, we'll be taking a look at the veterinary program. Look at those cute little kittens. I can't wait. Well, this has been Learn This. I'm Keenan Kreller.
And I'm Olivia Cannings. Stay classy, Algonquin.
So how long would the average massage?